Okay, welcome back. So now let's talk about noses. And like I said in the introduction, nose is all about cartilage, right? And specifically, there's three pieces of cartilage that you need to know about for the kind of exterior forms of the nose. Something called the alar cartilage, something called the lateral cartilage, and something called the septal cartilage, okay? And you can see them in different locations here. But before I go too much into these different pieces of cartilage, I'll just talk a little bit about the nose in general. And the nose is kind of very sensitive kind of plane to deal with, right? It has very distinct angle changes at the different inflections between these different pieces of cartilage, right? And this is most apparent in the profile, right? Because obviously you're looking straight at angle changes. And that's the most immediate way to assess the character of somebody's nose in profile. If you're looking in a front-on view, you're not assessing changes in silhouette, you're assessing changes in tone, right? As light hits these different planes in slightly different ways. So it actually became very difficult to characterize a nose just from a front view, right? Because it's foreshortened almost entirely. And a lot of times in fashion photography, they use that advantage to photograph people who have relatively kind of unsightly noses, long or hooked or whatever. You know, you tip your head the right way in the front view and you can get around the problem. You can't avoid it in a profile. So anyways, what I'm saying is we start here at the nasal bone, and in profile we're progressing our way along this, and we look for a distinct transition at the end of the nasal bone. We're fairly familiar with the kind of how this looks now, having studied skulls for a few weeks. So from here we can either go up, go straight, or go down, right? And it's the transition point here from bone to cartilage. And specifically in profile, you're looking at the kind of silhouette of the septal cartilage, which is cartilage that runs straight down the center of the nose, right? A little wedge of it. If I just drew a quick socket, nasal aperture, something like that. Teeth down here, mind you. So you see the little nasal spine here, you see bone up here. Septal cartilage just kind of goes straight down the middle, just like a little plane just sitting in the midline of the body. And this is actually a continuation of a bony septum that divides the sinuses deeper in the nasal aperture. Okay, so we make our way down to kind of the bottom of the septal cartilage, and you'll see here, at least in the profile, that this starts to dive around and shows up again here, right? Because at this point, what happens is you get these two pieces of alar cartilage that wedge onto it either side and just kind of slap together, and those create the ball of the nose, right? The dome of the nose at the end. And these are the things, these greater alar cartilage are the pieces that make crazy shaped noses, right? That gives all the variation. You know, you get angulation from these, from kind of the septal cartilage, how it transitions from here, or you get a bumped nose, crooked nose up here. But when you see somebody with a huge bulbous nose, that's big alar cartilage. Okay, the shape of this is actually reasonably complex, and it's quite it's almost comma-shaped in profile, right? And that's probably the best way to think about it, is that you have this fairly kind of prominent half ball, right, if it's cut in half, and then it loops around, and as it kind of tucks back under to form the inner wall of the nostril, it diminishes down to a tail, and you can see it here. All right, so inner wall of the nostril, and gets reasonably thin. Collectively, this transition of the alar cartilage down to the rest of the septal cartilage is called the columella. And you'll see that this, in relationship to the opening of the nostril, is a big kind of determining factor in the character of somebody's nose, right? You can have just standard, or you can have a hanging columella, which is one that bows way down, or you can have a really shallow one that doesn't expose any nostril. So there's, like everything that we've talked about so far, it's the bell curve, right? All these pieces, the kind of Gaussian distribution applies to each one of them. So, you know, all of it can be quite fuzzy and make really unique shapes. Let me just show you a couple more images of this to maybe just re-emphasize and get you thinking about this stuff spatially. So these are Bridgman drawings, just kind of breaking down the pieces, right? Lateral cartilage. I didn't say much about lateral cartilage, but lateral cartilage essentially, when you're leaving the profile view, the lateral cartilage bridges the gap between the line of the septal cartilage going down the bridge of the nose and the bony kind of the lateral wall of the bony opening of the nasal aperture. Right, so that just makes this transition kind of plain. Okay, and again you can see the alar cartilage here, right? Kind of looping around, and various things happen. Sometimes it has a little bit more extension than others, sometimes it doesn't, right? So all sorts of shapes. And then the last piece of the puzzle, which I haven't talked about yet because it's not cartilage, is the wing of the nostril, right? And the wing of the nostril is actually just kind of fatty tissue, right? Kind of fibro-fatty tissue, right? It's not, which is kind of like what's in your heel, right? It's kind of fat, kind of interwoven with all sorts of kind of fascia and just kind of really tendinous tissue. And I say that because if you diet, for example, if you go on a starvation diet and lose a lot of weight, you're not going to lose your nostril, right? It doesn't work like that. Okay, but this is really breaking it down. That's what it looks like when the skin is peeled away. Okay, so the important thing to know is that all these different things are there and visible on the surface, right? Some of the construction gets masked a little bit when you put a millimeter or two of skin on top of it, but you still see all sorts of plane changes in the alar cartilage. You see transitions from point to point through these different sections. Okay, now let's look at some other things that happen on the nose. The nose, interestingly enough, has muscles on it, right? I'm sure probably you're aware of that, but for the most part, you don't consider the nose doing anything. So I just threw in these really kind of nice medical illustrations just to give you another view of the cartilage. Again, front view, septum going across down the middle, lateral cartilage, alar cartilage, and the wing of the nostril. Okay, I'm not really concerned about many of the nose muscles, right? You have like a dilator and a constrictor or something down here. I don't really care. Occasionally, if you're doing a character for film or something or whatever, you'd have to do a blend shape or a sculpt for a nostril dilation. That's where that one comes from. The one that I wanted to point out to you is this guy, which is called nasalis. And he just crosses the bridge of the nose, kind of spanning right over the lateral cartilage and the septal cartilage. Kind of grabs onto some fiber on the apex of the nose and then goes down the other side, right? And I mentioned this guy because For the longest time, I couldn't tell what was making this little continuation of form up here from the nasolabial furrow, right? You have this kind of fatty pad here, right? The malar fat pad. This stops right about here at the base of the nose, right? That's where it ends. And nasolabial furrow kind of tucks up over the nose, but on certain people, you'll see this furrow transition up over the nostril. And I could never explain it, but it turns out, after a little bit of detective work, it is, in fact, nasalis, right? Your little nose muscle creates that form. Okay, I'm going to show you a couple dissection images right coming up. So if you're kind of grossed out by seeing all this cartilage and dissection, look away and come back in a couple minutes. But this is what it looks like, right? So this is actually dissected down the center line. You can see the nasal bone quite clearly. All the muscle's been left on this side, right? So we actually would have all this covered with nasalis, amongst other things. But instead we see the septal cartilage going down the middle and lateral cartilage here. And this is the shape of the alar cartilage, right? Right, and look, notice for me, please, while you're watching me kind of just scribble around this, right in here, this is the important part of alar cartilage. This is a big plane change on a lot of people, where it kind of goes from a nice rounded shape, the ball of the nose, and as it moves anteriorly and kind of inferiorly to become the columella, there's this pretty abrupt planar shift, right? And really important to know that's there because you'll see it all the time when you look for it. Okay, and then we transition down, and this, remember, wraps up like this. Okay, and then the wing of the nose, the nostril out here. Okay, one more view of this. This is kind of just a total mess, and we'll see this guy again. This is just showing you probably a better view of nasalis and why it does contribute a little bit of surface form on certain people, right? This is it. It's kind of reflected just a little bit, but you can see that actually, yeah, it does have some substance. So that will kind of, on some people, make a continuation of the furrow, right? For example, here. Okay, that's not alar cartilage, right? You could be confused to think it was, but the alar cartilage is going to be more like that. All right, fibrofatty wing. Kind of the border right here for the malar fat pad. And then that's kind of the little bit of convexity due to nasalis, right? So just know that he's there. You won't see him all the time, but it's good to know that that happens, right? I don't know if you can see, it depends on the contrast of your monitor, but this is what I was always concerned with, right? Oh, that's obviously the nostrils there, but then there's just a little bit more up there, okay? While we're on the slide of kind of older Audrey Hepburn, notice this transition plane, right? Look at that. Nice and sharp. That's exactly what we were looking at on that other image, right? Kind of the dome up here, and then that sharp transition, then it wraps around and makes the columella. Okay, there's going to be even grosser stuff coming up, so this is just like a slide of warning. It's not coming up yet. I'm going to show you the preface, the gross stuff with this image, just showing how kind of all this stuff works, right? So in general, if you're looking at an image, you can kind of look for to find the end of the nasal bone, look for a change in color, right? So kind of whitish up here, and then it goes a little bit a little bit redder typically on almost everybody's nose. So that's usually if I'm looking in kind of a front view and I'm trying to see where the shift happens. That's one indicator. Otherwise, just look for evidence of transitions, right? And we can kind of see a wedging in here. You feel that kind of diminish from this width, kind of goes in, wedges in. And then you actually have two big, pretty lateral, wide kind of alar cartilages, right? And you can see kind of a bilateral or kind of a division down the middle, right? And we know that because there's two pieces just kind of wedged together, right? And this was her big problem, and she went to the plastic surgeon to have that fixed. And so I guess what I'm going to show you next is what they do to just kind of bring these in a little bit, right? Just too wide up here. And so now those are tapered in, and it just makes a nice kind of ball of the nose as opposed to a wide kind of ball of the nose. So, okay, turn away. This is kind of gross. I made it grayscale, but anyways, this is what happens. And I'm showing this purely academically because it illustrates for us exactly what happens and how, in fact, just kind of planar this transition is. Right, we're not even seeing it on this side, but her nose looks so bulbous because you can see that these have this big space in here, right? So you can kind of feel how divergent it is if this is the front view, right? Just what we looked at. And so this guy, the surgeon, I guess, is going to cut away a little bit in here, take some of that out, take some of that out, and then just wedge them together a little bit tighter and then reduce the width up at the top, right? It's just like working on sculpture, but it's all kinds of the different sort of clay, I guess. Okay, so yeah, kind of interesting, I think. I was actually pretty happy to find this image. Slightly nauseated the first time I saw it, but I'm used to it now. Okay, so let's look at a couple variations in noses and just talk a little bit more. They're not that complicated when you distill it down to its component parts and just realize that they always have these transitions, right? And so kind of see the end of the nasal bone, right? You see where it transitions from this kind of continuous shape and then it just wedges down, right? So this is a very kind of small nose, you would say, kind of really thin compared to this on the opposite side, which is just kind of a bulbous nose. And look at the coloration difference. You know, so we'll see nasal bone end there. And it's hard to pick out because it's all fairly unified when you put a thick layer of skin over top. But you can see that this guy's sporting some seriously wide alar cartilage, right? And this is, again, this is the beauty of the gene pool, right? That all sorts of things can happen. All right, this slide is the same person. Hopefully it's obvious, but maybe it's not. Probably obvious because I put them on the same slide. The point of this one is to illustrate how important understanding the profile is to capturing the essence of a nose, right? Because you can see all these transition points that I'm talking about. And even look at that nice plane change. We've just kind of appreciated that in pure cartilage, but that's what it looks like covered over. But if we take all these plane changes and we're looking at it in a kind of a pure front view, you can't make any of those out, right? You're only looking at slight shifts in tone, right? And not only tone, but also kind of, I guess, more helpful is widths, right? And when I was studying in Florence, we were doing portrait sessions, drawing big kind of long pose portrait sessions, maybe 20 hours, something like that. And my drawing was progressing pretty well, big charcoal drawing. But then the instructor came around and said, "Scott, the nose is not right." And I looked at it, and it was the right length, it was the right width, it was the right everything, but it was more or less flat, not just flat in width from kind of nasal bone down to tip. You know, I had some alar cartilage, but I didn't have any subtle kind of variations in width. I didn't have any subtle variations in tone. And those are the kind of things that make it the surface alive, even though they're just a couple degrees. Okay. Let's look at a couple more noses. So again, just trying to show the amount of variation that can happen. And how planar, in fact, the cartilage can be, right? And then it wedges around and wraps up. Also really nice to see this while we're at it. I mean, all these things that we've talked about so far, we can kind of appreciate again. All right. Okay, again, just kind of a variation in width. I actually included this one to talk about nasal aperture, right? Because you don't generally have a super wide nose like that unless you have a wide nose opening, right? This whole structure is just mechanical for bringing air into the nose, humidifying it, heating it, and then exhaling it, right? Purifying it, cleaning it a little bit as well, right? So essentially, the big mechanical inlet valve covers an equally large kind of opening in the skull, right? And generally, it's like just a few millimeters that the nostril spans around the opening. Okay, and then air goes in. This view shows just a really nice wedge, how the kind of septal lateral cartilage really can wedge in between the kind of a really elongated alar cartilage. And one thing I don't think I explicitly mentioned a couple slides ago, but when we're looking at all this soft kind of tissue of the nostril, just remember that this is fat and not cartilage, right? So you're not going to get big plane changes. You know, we've seen all this plane shift here of the cartilage as it wraps around. You don't get that on the fatty wing because it's just fat. Fat doesn't take its own unique structure. It's not capable of holding those kind of planes. And so whenever you're constructing a nose, you know, you can have all sorts of crazy stuff going on in the cartilage, but this is always just a nice kind of relatively smooth transition, relatively smooth form transitions onto the more irregular cartilage. Okay, again, just kind of appreciating it in profile. I'm sure this guy's nose has been broken a few times, but again, probably what's gotten crushed down is the septal cartilage is just crushed in, and you can see the distinct transition between these regions. Okay, it kind of goes this extreme, right? And one thing that I'm just going to start to mention is lighting, right? Lighting plays a big part in how you read reference and how much information you can extract from it. We're getting nice specular highlights on this, and that's giving us this information about kind of two big balls of the nose. But if you light this guy with a bit more contrasty light, you can really see what's going on. In fact, he kind of has a bottom for a nose, doesn't he? Give me 1 second. Let's see where I'm going with this. This is actually a Russian dancer. Could refine the anatomy in a few places, but You get the idea. But yeah, look at that. With my drawing erased, you can appreciate probably the structure a little bit better. But look at how separate the lobes are, right? The two pieces of cartilage. And this is, this is easily a couple standard deviations out the bell curve, 2 or 3, in fact. But it does happen, and to famous people as well. So a couple more, just another contrast of wide and narrow. I could go on forever, just all these different shapes are quite interesting, but they're very predictable, right, as a pattern. Okay, just a couple more slides on those. This is about what I was just alluding to in lighting, right? You look at her nose and you think, this is a nice, perfect straight line. A little bit of form there, but that's really kind of perfect, and you would maybe draw it like that. Or if you were using just a little bit of reference for sculpture, you might missculpt it, right? Because in fact, you light it just a little bit more contrasty, a little bit from the side, for example, and you can start to see all sorts of shifts in form. And this is this is the rule. This is absolutely the rule. So you have to look very closely for it, right? Don't assume if you don't see it that it's not there. Assume that it's there and you can't see it. Okay, so again, just all the different relations. Okay, and now let's look at a little bit of plastic surgery on noses, just to see what variation people tend to get corrected when they go to plastic surgeons, and kind of how they do it as well. So this guy was kind of a little bit unhappy with, well, the downward angle of the nose, right? So he went in and he wanted to get the tip lifted, right? And so kind of remove the hump, retract the tip. And so there's a few ways that they do these sorts of things. I'm definitely not a plastic surgeon, so don't take anything as I say as gospel. But this is always kind of interesting to me, that if you want a rhinoplasty and if you have kind of a crooked nose and you want it fixed, they don't just go in and shave off the top of it. That would, to me as a layperson, that would make the most sense. Right? Oh, it's a little bit of bump, just go plane it off, get the sander. But I guess, thinking about it, maybe all those muscles that we were talking about and that we saw kind of inserting over the top and going down like this, those might kind of come into play if you just try to sand it down on the top. But so instead, the other option is to go in through the nose, right? And so what they do is they get a nice little chisel, something like this. I'll just draw, look at this, the beveled edge even. Look at that rendering. Chisel, and it goes straight up the nose, and they break the base of the nose, and then it gets pushed down this way, and this kind of goes somewhere. But the overall effect is that you're able to flatten the tip. Shocking. That doesn't sound like the most pleasant thing. Other things, so bulbous nose. This is what we've seen quite a few bulbous noses in the last set of slides, right? But just a lot of width, right? And the reduction is kind of related to all that stuff we saw, right? They just want to. This doesn't need to be reduced, but kind of the overall size of each hemisphere of this alar cartilage needs to be reduced. So in fact, it's probably just going in and taking out that middle piece of the cartilage, and then they suture it together, and bam, a nice ninja tipped nose. Upturned noses, right? Upturned noses, Downturned noses, this is kind of the opposite problem, and it's the problem really is not so much that the nose is upturned, but that the columella is so prominent relative to the nostril, right? So it probably is a little bit upturned because this angle is quite extreme, but really it's just showing too much nostril in profile, right? So that's something that you always want to assess when you're looking at a profile. And so the fix, to my eye anyways, it doesn't look so, it's probably a small angle change. But the bigger effect is not just rotating this down. The bigger effect is that they've actually taken the time to reduce the disparity between the bottom of the nostril and the columella. Okay, and speaking of columella, this is the same thing on just a regular nose. So congenitally hanging columella, just a big nostril visible in profile, right? And nobody wants that, I guess. And so that's it, just kind of reduce it. And you can see here kind of plane changes and everything happening. But it just ends up being that the dip of kind of the inferior margin of that alar cartilage goes too low. Okay, and now I'll just take a moment and just show kind of constructing a nose on the opening of the skull. Okay, so let's just do a little bit of drawing on this skull to talk about, working through a nose, right? So kind of what we're looking at is, let's just block in some of the orbits. So I'm just kind of in trace mode right now. But kind of what we have starting to emerge, and we'll see more when we get into the lips, is we're starting to see that there's actually a thickness to the skin on top of the bone. And certainly we know about fat, right? So if this is actually the kind of the zygomatic bone, we have a bunch of fat covering out in here generally on most people, right? So we're building out from the surface, but for the nose, for now anyways, let's just treat it like it's building straight into the aperture. You saw in the slides that there's a pretty thick layer of skin that goes over top of it. So just kind of simplifying the nasal aperture to start with into kind of a rectangle. Okay, and when you're looking at anything other than a pure profile, you have to consider kind of foreshorten what the projection of the nose is going to be like. So is this guy going to have an upturned nose relative to kind of the plane of the face, or is it going to be straight out or downturned like we've seen some on a couple images? And I think straight out, right? So this is kind of shooting a ray out. You guys can draw, however, this is, again, not a drawing course, but I want to talk about the construction as I do this. And so I'm just kind of looking at this that I've just blocked in as approximately the width of the nostril, right? And then kind of, I suppose, the best way to proceed is to just find the center line, which would be kind of the septal cartilage, and then you can start to build the nostril or the alar cartilage off of it. So remembering that it's kind of these bulbous pieces that are a little bit teardrop shape, right? So to wrap back kind of like this, kind of thinning out as they go back, but then they wrap under and they're going to grab onto the center line that we've established, right? So it'd be like that on one side and that on the other. As we're kind of projecting out here, the next kind of transition point here is the lateral cartilage, right? So all this is going to wrap down, and we'll see this wedge in between this this alar cartilage. And let me just see if I can zoom in closer so this is bigger on your screen. So kind of from here, we're building the nostril off the outside, kind of laterally. Right, and the nostril is just going to be this nice round tissue. It's going to slide up and just kind of blend on. So right up here, you don't see a distinct boundary between these two, right? It generally, like you took a little piece of clay and you smeared it this way onto the alar cartilage. That's kind of how it works with the nostril, right? You have nice defined borders here, and on the bottom it kind of wraps up. This varies from person to person how much the nostril kind of wraps up underneath itself. But so edge, edge, boundary, and then soft transition. Okay, so there's a simple nose. Of course, in all these, all the stuff that we're looking at now is just kind of building out things that we know, right? So we already know about infraorbital furrow, nasolabial furrow. And here we have our medial canthal tendon, right? It's kind of the opening for the eyes. We can kind of block in an eyelid. Lower eyelid is the first one to go. Upper eyelid. A little bit of thickness to the upper eyelid as it wraps around, rolls back. So this upper tarsal plate, lower tarsal plate. Fat in here, fluffy fat if you want. I'm not going to finish this, by the way, if you think I'm going to continue to sit here and draw. My primary objective was accomplished, and I won't bore you with the rest. Just a little bit on drawing noses, right? I will probably do another one for kind of the assignment video this week, but that's the start of it, okay?